another episode of What You Don't See Matter with Karthik. Thank you so much for all your support. Today I had a great and detailed discussion with Dr. S.K. Nair, a renowned cardiac surgeon. We dwell deep into evolution of cardiac care, role of technology, instrument, and system working behind the scenes that support successful patient outcomes. Let's get started. Welcome, Doctor. Thank you so much for joining us today. So, given this, could you tell us your journey and what inspired you to pursue cardiac surgery?
It's a long story because it started 40 years ago. In 1986, that's when I joined cardiac surgery training in Mumbai. And even before that, I had been exposed to cardiac surgery at the Postgraduate Institute in Chandigarh. That's where my interest in cardiac surgery started. And it's been a long journey which I've thoroughly enjoyed, more than 40 years. And I've seen a lot of change happening in cardiac surgery. And the results have improved greatly. The equipment which we use is very advanced now. So on the whole, it has been a very satisfying journey.
So cardiac surgery has evolved tremendously over the years. What is the biggest change you witnessed in technology and patient safety?
So I think the major, if you look at it from the very basic, simple things is like I always say that the most important instrument is a sterile instrument. So, in the old days it was all flash or autoclave. A lot of things were reused, a lot of even from the syringes to the hypodermic needles, all were boiled and reused on multiple patients. So there has been a complete revolution as far as sterilization procedures are concerned. And I think everything starts from there. I always maintain that operation may start at 8 o'clock, but the procedure actually starts much before that in the CSSD, when all the instruments are prepared for the surgical operation. So I think the most important, for the last 2 centuries, I think for surgery, it has been infection control.
So technology has undoubtedly transformed patient care.
Absolutely. I think there has been so much of change over the last 150, 200 years in making surgery safe for patients, because the mortality related to surgery was mainly from infection. And now, of course, it still is a big challenge. And therefore a lot of attention has to be paid to infection control and sterility of instruments, sterility of environment, and everything else. So I think the biggest progress has been definitely, one of the major areas has been sterilization.
So how important are the reliable instrument and the technology in achieving successful surgical outcomes?
So like I mentioned, like most important instrument is a sterile instrument. So there have been so many changes. There are certain basic sensor instruments which have been the same all along. The scalpel, needle holder, needles, suture material. It's the latest technology is use of microchip processors, chips, lenses, which have made major advances in surgery. And so these kind of sensitive instruments require high technology to keep them sterile. So, with the introduction from autoclave to ethylene oxide and now to high temperature plasma sterilization to now the latest low temperature sterilization techniques, plasma sterilization techniques, is what makes the technology workable on the patient. Because even if the technology is high, the instrument is unsterile, the patient will not survive. So basically an instrument, these things have to go parallel. I think technology and technology of instruments, technology of sterilization, all these have to run in parallel for good patient outcomes.
Rightly said, Doctor. In cardiac care, even a small lapse can have a serious impact. How important are this system working behind the scenes?
I think, like I said, it starts on the CSSD and in infection control practices in the hospital, and now CSSD has been linked to everything. So CSSD is linked to the hospital infection control committee, it is linked to the accreditation processes. So CSSD has become a central pillar in the hospital. And it is extremely important that the CSSD is manned with the best, has the best equipment and also very dedicated professionals.
I think great point, Doctor. When we talk about the patient safety, it's not just about the procedure, but everything that supports it.
Absolutely. So procedure, the surgeons can do a good job, but there are so many other things that play a major role in the outcome.
That brings to my next question. As instrument became more advanced, how important is to use technology and protect it?
Yeah, absolutely. Because like I said, nowadays it is like a robotic instrument is a very expensive. It's got limited number of users. You cannot spoil it with one